everybody, and welcome to this Wish panel discussion where we're looking at the healthcare challenges in hosting major sporting events. We know that they can provide a multitude of benefits to the host countries, valuable infrastructure investment, tourism, loads of things, which hopefully we'll discuss all of that over the course of the next hour or so. And you heard quite a bit of that from His Excellency Hassan Al Thawadi, the Secretary General of Qatar's Supreme Committee for Delivery and Legacy. Now, the Wish Health Challenges in Major Sporting Events Forum discussion will explore, as we say, over the course of about 60 minutes or so, with loads of questions, hopefully from you, all of you who are watching in various parts of the world. We'll look at some of those key challenges in greater detail over the course of the next 60 or so minutes. So thank you so much for being with us. So thank you once again for being with us. Let me introduce this wonderful panel, which we've managed to assemble for you today. We have, if you can all give us a little wave as I introduce you, we've got Abby Hoffman, who's Senior Executive, Ministry of Health, Canada. We've got Dr. Abdul Wahab El Musla, who's the Deputy Executive Director, Medical Affairs, Supreme Committee for Delivery and Legacy in Qatar. Thank you so much for being with us. Professor Lucille Blumberg, who's a Deputy Director from the National Institute for Communicable Diseases, South Africa. Incredibly long title as well. Thank you for that. Tina Endricks, who is Head of Global Health Security from Public Health England. And last but by no means least, we have Ken Scott, who's the Head of Inspectorate from Sports Ground Safety Authority in the UK. Ken, lovely to have you with us. Thank you, all of you, for being here. And another big thank you to everybody who has joined from various parts of the world. The plan for the next hour or so is to have a good discussion with our esteemed guests here, and we'd love you to get involved. So do send your questions in using the usual channels, and we'll try and get through our experts as we can, and we'll have a good discussion, hopefully, and you'll be able to get some takeaway from it. So as we set things up and look at these healthcare challenges, let's have a look at a film which Abby has made for us, which can set us up for our discussion today. So take a good look.
Hello, my name is Abby Hoffman. I'm from Canada. I'm a senior executive in the Ministry of Health for Canada and a member of the Executive Board of World Athletics, the governing body for track and field internationally. Leading countries and cities on every continent have hosted major international sport events for many decades. These events are opportunities for host nations to showcase their unique cultures and logistical capabilities. The biggest events bring people together as the world pauses to celebrate excellence and cheer on their nation's teams. The enormous costs of staging these events notwithstanding, many nations and cities see a major sport event as a unique way to raise their profile and put themselves on the global map. The data on the economic benefits of staging major sporting events show mixed results, but the reputational opportunities are far greater, especially for newly emerging economic powerhouses. A successful event with captivating venues, exciting new infrastructure, and the use of innovative technology to event presentation can pay huge dividends and vault a less well-known country to world-class stature. But as is the case for any mass gathering, there are considerable risks. Mass gatherings take many forms. They may be spontaneous or planned many years in advance. In either case, the assembly of large numbers of people in one place doing things they do not normally do in an unfamiliar and unique environment inevitably poses challenges for the health sector. Our focus is on recurring international sport events, the Olympic Games and other multi-sport events, and single sport world championships such as the World Cup of Football can be equally complex. These events involve large numbers of participating teams, domestic and international visitors, media, organizers, and support personnel gathering for anywhere from a few days or weeks to a month or more, and often in multiple locations requiring considerable movement around the host country and all the pressure on infrastructure and local populations that entails. The COVID-19 pandemic has forced the sport world to deal with the most extreme situation of risk and uncertainty it has ever faced. Agonizingly difficult decisions have been made to cancel, postpone, or drastically modify the conditions under which major events can take place. The unpredictable trajectory of the pandemic, the rapidly evolving and changing understanding of the virus make planning and executing countermeasures to ensure the safe delivery of events extremely difficult. The best advice changes literally on a daily basis. Events whose success normally rests on assiduous planning and immaculate execution are now faced with preparing for multiple scenarios and unknowns. Lessons from the experiences of host country organizers and international sport bodies as they execute events during the pandemic will be invaluable. If multi-sectoral collaboration was a key success factor in the past, the pandemic has made it even more compelling. Our report focuses specifically on the health and public health challenges which arise in the hosting of major sport events. Our goal is to outline how governments, policymakers, public health authorities, and healthcare systems can and must work together in the lead up to and during an event in order to, first of all, protect the health of visitors, spectators, participants in the local population. Secondly, use event planning efforts as an opportunity to design and put in place a lasting health and public health legacy in the host cities and countries. And thirdly, to ensure that this knowledge and learning is shared with future hosts who can adapt that intelligence to their own situations. These three areas are, in our view, positive health goals for any major sport event. And we make recommendations in each area to help policymakers planning for future events. Each event is different, and each benefits from the in-depth guidance provided by the corresponding international sport governing body and previous hosts of the same event. Our recommendations complement that advice. Of course, external guidance must always be implemented in a way that takes account of the specific context and situation of a host country and host cities. As the calendar moves closer to the Qatar 2022 FIFA World Cup, we hope this forum report furthers the case for evidence-based, multi-sectoral, transparent planning and execution for future events. Mindful, of course, that the need for agility and adaptation when circumstances change, as they invariably do, is equally critical. Thank you, and we look forward to joining you and you joining us for the Wish Forum session on international sporting events.
Thank you very much for that, Abby. I do like the way you're wearing exactly the same neck scarf for this as you were for that. Beautiful planning. I feel like I should give a bit more information about Abby as well. She is, of course, a world-class middle distance athlete, 4 times appearing in Olympic Games, Commonwealth Games, gold medalist as well. So when it comes to these big events, she knows her stuff. So the plan is I'll kick things off with some questions to some of our panelists, and then do feel free to get involved. And Tina, I'd love to come to you first of all, listening to what we've heard already from Hassan and from Abby, and bearing in mind going back to London in 2012, I think, where legacy planning was central to London's bid to host those Olympic Games. What are we now, 8 years ago? There was regeneration we saw in East London, encouraging sports participation, trying to strengthen the public health systems as well. How do you now, Tina, I suppose, look and evaluate the success of what you did then? And I wonder whether you'd do anything differently if you had your time over again.
Thanks, Dan, and really pleased to be here and be able to be part of this panel. It's always interesting looking back. 8 years seems an awful long time ago now, and the world is such a different place now. Really pleased to hear about some of the legacy work that's going on in Qatar, and great for them to be looking at that. I will say that though legacy was an integral part of the London 2012 planning. From a public health perspective, where I was sitting, it wasn't always where the key focus was. A lot of it was around getting everything in place and operational actually for the games themselves. But as you say, there was a huge amount of investment. The UK government took the opportunity to place London 2012 in the East End of London, which we normally have about 6 million visitors during that same period as we ran the games in London 2012. We would never normally send them to the East End of London. So it was an opportunity for investment in that community, building a lot of infrastructure, transport, housing, businesses, the Olympic Park itself, which became a major part of the legacy. That's now a major sports stadium for football, but also the velodrome, the swimming pool are used by the local population, and that's given them a central hub to actually improve lifestyle. The venue where the Olympic Park was built was actually a really run down, very polluted, contaminated site. So there's a lot of kind of work done of the renovation and remediation there to be able to build that. So huge investment, but actually it's a fantastic area and part of London now, and actually a place where people choose to go, which I would have said a few years ago might not have been the case, and apologies for people from that area for saying that. But it's really difficult to evaluate. Some of the infrastructure things, the things we've been talking about, they're easy to judge. But from a public health perspective, it's quite difficult to actually measure when you look at doing some of the behaviour change activities about how you kind of try and improve hygiene practice to reduce the chance of infectious diseases. Very, very pertinent now with the COVID-19 pandemic going on, and there'll be some interesting studies on that about the changes and improvement in hand washing hygiene practice longer term. The belief is that there will be a reduction in other infectious diseases because of it, but it takes a long time and a lot of repeated messages for shifts to actually happen, so that'll be useful. There was an uptake in some sports activities, so cycling particularly from London 2012, huge amount of interest and investment on that, not only maintaining the velodrome in the Olympic Park, but the amount of cyclists on the streets and roads of London now. But that is successful because they then put all the cycle lanes in as well and invested in the infrastructure to enable that to happen. So I suppose my message is that it's not easy because there has to be long-term funding and that's sustainable to actually make that difference and that long-term legacy. From a public health perspective, we invested in improving our surveillance systems. So we put some additional ones in. We did a big exercise on what we've considered the main risks from a public health perspective and what we need to do to have the assurance when we had our Prime Minister phone up at 4 o'clock in the morning saying we have a rumour that somebody's ill and this is what's caused it. We needed to have the access to the systems data intelligence to be able to provide a robust answer to that and understand what was going on. So we improved a couple of what we call our syndromic surveillance systems, which are just routine systems that pull data out of your hospital A&E department and analyse that to see if there's any difference against the normal data that comes through. And we've maintained them. They are now part of our routine systems, which is really brilliant, and it's given us more robust systems. We also invested a lot in the people, about the training, capacity building. Again, that was really good. I will say that some of it is obviously short term. There's a lot of attrition of people after the events, people move on. So when you're looking at reviewing your legacy afterwards, and I'm involved in part of the upcoming Commonwealth Games planning in Birmingham, there's only about 3 of us left in the system. So some of that institutional learning and knowledge does actually go, and that's one of the things that why it's important to do documentation reporting very, very quickly afterwards. So I think there's some really good things, but it is more difficult than we'd actually imagine. I think some of the things I would say for people, it's about having it as part of your core planning, which it was, but there wasn't a huge investment from it from the UK government perspective for the public health particularly. We had to kind of fight for some money. But the benefit has been realised from doing that and making sure that's part of our core business now. It's around engagement, about making sure that everybody involved understands why this is important, having from the host organisation, the IOC, FIFA, the government, the host city, the public, so people understand the benefits for hosting and being involved in these events, and then they will buy into it. You'll have that continued engagement and involvement going on. We were very much also held to account by UK government for spending UK funding. So actually we had to demonstrate the benefit long term and why we've maintained this and why we needed additional funding. And I think there's something around building the evidence base, what really actually works, what should people be looking at for future events and hosting and sharing that documentation. I'm lucky it's now part of my core job that I get to travel around the world and tell people about their planning and legacy. But it's something that really needs to be embedded in the process of transfer between events and host cities and organisers. So I think that's probably the two key things I think need to be done about that kind of buy-in and the sustainable funding and sharing the kind of like the core learning. You wanted me to mention something about what will we do differently. I think it is around starting the planning earlier. From the public health perspective, we were planning for our legacy while we were actually in the middle of the games, to be honest. We'd done the work to identify the core systems we wanted to do, but around doing some of that evaluation, we didn't invest the time to do the research and the monitoring and the long-term evaluation. It's easy to do it quickly after the event, but to actually gain a real insight into it, it needs to be a long-term programme of work. And unfortunately, we didn't have the opportunity to do that or the foresight to actually think that we needed to do it at the times. When you're in the middle of doing it, it just doesn't quite happen as well as you'd like it to be.
Well, I think we all appreciate your honesty on that one, Tina. Thank you very much. And I think it's really important, isn't it, to be open and honest about things that you've learned from what you did right and things that you could have done slightly better as well. And Abby, to pick up on some of those points, and Tina's talking about that really delicate balance of trying to get things right around these major events. And one of the constant issues through the planning and then actually putting it on as well is trying to balance those strict governing body demands at the same time as keeping the local population happy. So how do you do that?
Well, look, that is an enormous challenge, and I think it's probably fair to say, building both on what Tina said and I think experience that anyone associated with any of these major events has had, is that there are forces that really conspire against a focus on legacy and the aftermath and the longer term, and conspire against planning, mapping out, and fully executing a broader health agenda. So let me just say a little bit about that, because I think understanding those pressures can be helpful. First of all, it's good to remember that when a city or a country wins the right to spend millions, hundreds of millions, maybe even billions on a major sport event, they've done that at the end of a very competitive process through which the international governing body, who is the franchise holder, has set a very high bar. And this prospective host city or country, in the course of presenting themselves and their candidacy, make all kinds of commitments. And they make commitments mainly about how they will deliver the event. Sure, they talk about legacy, but they know that the decision ultimately is going to be, are they going to execute this event in a way that helps grow the international audience, that adds to the reputation of the sport, and burnishes, frankly, the reputation of the international governing body. These are the things that are looked for. And, that host city may not realize what they're getting into, although they've talked about it. And frankly, the international franchise holder they are conflicted, but they capitalize on this dynamic because on the one hand, they want the security of believing that the host hasn't overreached, that actually has the capacity to do what they say they can do. But at the same time, they're actually exploiting, maybe in a positive sense, the preparedness of host cities and countries to make a monumental effort, mobilizing resources, creativity, and innovation to put on a fantastic event that will further enhance the reputation and value of the sport. And so, in the aftermath of the successful bid and in the years that follow, the host country will feel this incredible pressure to fulfill all the commitments that it has made. And this is positive in a way. They're motivated by that sense of commitment, but they're very conscious of the reputational risk that is associated with the possibility of failure in some element of game staging. And the result of that is that dealing with the immediate objective of staging the event successfully tends to overwhelm the best intentions that they may have expressed initially about protecting the local population and achieving other more important, or at least equally important, domestic objectives, including in the health sector. And this pressure is unrelenting. The international body continues to monitor developments closely. Delegation after delegation arrives in the host city to meet with the local organizing committee, public authorities, you name it. And frankly, the contract that the host has with the franchise holder allows the franchise holder basically to give direction on anything and everything. And I'll just give you one example. Last November, just 7 months before the Tokyo Olympics, the now postponed Tokyo Olympics, but the International Olympic Committee not asked, told the Tokyo Organizing Committee, guess what? We're worried about a heat event, and you're going to move the marathons from Tokyo to a city almost 1,000 kilometers away in Sapporo, Japan. This is a monumental shift and an expensive one. But in this case, the IOC had all the marbles, and frankly, the Japanese organizers had none. So let me just make a couple of other comments. In our paper, we sort of set out this a sort of triad, if you like, of health objectives and requirements for these events. Obviously, they're ones immediately associated with staging the event, the known ones, provision of health services, and so on. Then there's a category of possible health risks. Could be infectious disease outbreaks, water or foodborne contamination, the health aftermath of a catastrophic event, something of that nature. Clearly, the organizing committee has to deal with those kinds of events and prepare for them and have the infrastructure in place to ramp up capacity quickly if needed to deliver should one of these events materialize. But then thirdly, there is this area of interest that Tina touched on, which is the use of a major sport event to achieve public health objectives. They could be physical activity, clean air, green transportation, smoking cessation, responsible alcohol use, healthy eating, avoidance of infectious diseases, you name it, all pursued in a manner which helps reduce health inequalities. That's a big agenda. And so the question is, how can a host actually make sure there's a focus on all three of these, and particularly the latter? So let me just finish with these three quick points. These are considerations that I think are really important. The first is acknowledging from the outset that there will be these tensions between the local authorities and the international franchise holder, and that they will need to be managed, and that the host needs to be resolute in dealing with them and managing that relationship. Secondly, the right organizational structures and governance relationships need to be in place locally. The LOC, the local organizing committee, is preoccupied with the event itself. Other public authorities have to be engaged to deal not only with supporting event delivery, but some of these longer term and broader objectives. And sometimes, maybe as we've recommended in our report, you need a chief medical and public health officer who is an individual. They may not have the authority, but they have a mandate to champion and express a vision about the breadth of the health agenda associated with one of these events. And finally, and I think Tuna alluded to this in her comments, for there to be a meaningful legacy, there has to be a real commitment to it from the outset. The good words that are uttered need to be operationalized. They need to be planned for right from the beginning, or otherwise the human resources and the mobilization that's required to meet those objectives just simply won't happen. So I'll just leave it at that and look forward to the discussion and the remarks from my colleagues on the panel. Thank you, Dan.
Thank you, Abby. Well, everybody seems to be talking about planning, and a bit more planning at the moment. And I was watching Professor Lucille Blumberg nodding along to both what Tina and Abby were saying, and to sort of come to South Africa, which I was there in 2010. It was a great football World Cup, but South Africa and Professor didn't have some of the, I suppose, the resources on tap that some of the other host nations of major sporting events have had. So were there any health-related opportunities that you could sort of highlight that anybody listening might think might be a good example for something going forward that you were able to do in South Africa?
Well, this was the first major, first time FIFA had been held on the African continent, and our first go at it. And the focus was on non-communicable diseases, on accidents, mass events associated with this kind of event. And communicable diseases were nowhere to be seen. And then influenza H1N1 came along, just as coronavirus has come along now, and it really changed the way we had to look at things. There weren't lots of resources. They'd been spent on infrastructure. So trying to, get the resources to focus on not just H1N1, but a number of outbreaks that were being experienced in the country was really quite a mission. We had a measles outbreak. We had a Rift Valley fever outbreak. One of the reporters got measles on the day of arrival. He was in an apartment block with 1,000 people in that building. We showed that he'd acquired it in Europe and not in South Africa, which was great, using good laboratory techniques. But we had to do something about H1N1. It was the second year of the pandemic. We kind of knew that it didn't cause severe disease, so that was a relief. But we had no bubbles, we had no distancing, we had no testing on site, we had no sanitizers, we had vuvuzelas that are great at transmitting respiratory diseases and are always at happy events. And I think we were quite lucky. We did close the schools, which were obviously a very important source of influenza. But, the event was held during our major winter influenza season. And I think we were lucky. I think H1N1, obviously realized wasn't that severe. I think closing the schools kind of pushed the influenza curve along. We managed to get hold of some new vaccine to vaccinate frontline healthcare workers. And I'd like to say luck favors the prepared, but I think we really were lucky. If this had been taken place after COVID, I wonder how the event would have looked. So I think my message is consider communicable diseases and set up a system where you can monitor a number of priority conditions, those that are going to change your event if they occur, because they're, I think on the African continent, I've been involved in sporting events during the Ebola outbreak. If you get a suspected Ebola or something that looks like Ebola, you can close your event unless you can confirm that it's not that disease and it's something else, that you're prepared to respond in advance and that you communicate very quickly. So I think communicable diseases are, I think we've learned now, absolutely critical in your preparation. And you need simple systems to monitor, to diagnose. You need some training of staff. These are diseases that many of them haven't seen. You need diagnostics that are accessible or you can refer to. And you need some infection prevention and control training. I think COVID has really shown the way there. So I think it's about being prepared to respond, not being taken by surprise, responding very quickly before rumors get out and harm your event. And I think those are the important lessons that we learned. I wouldn't want to do the FIFA now in South Africa post-COVID. I think it would be a very, very different scenario.
Yeah, and I think maybe all sporting events would be professional at the moment. And I know many people at the time wanted to ban the vuvuzela for the sound, but now you look back at it thinking what we're all going through at the moment. And that sort of communicable disease part of it as well. Let's touch on sort of what life will look like now then. And we're not quite post-COVID yet, are we? But we are in the midst of this pandemic. Let's bring in Ken Scott. Ken, thank you for being with us as well. You're behind a guide to safety at sports ground, which sets sort of UK and international standards as well. And there's new guidance as well, isn't it, about the returning of fans after the COVID-19 pandemic. So maybe you could give us a bit of an insight into the sort of planning and the things that you are adopting to ensure the health and safety of spectators at major events.
Okay, thanks for that, Dan. Yeah, I think the planning and delivery of any major sporting event will always present challenges for the event organizers, because they want to achieve the highest levels of public health and safety for the athletes, the delivery team, and of course those who are coming along to watch. But if you then throw into the mix that they're going to undertake that against the backdrop of a pandemic, then those established challenges increase significantly as the planning progresses towards the eventual start of that event. So my focus for the last sort of 6 to 8 months has been to work with the UK government and with the sports governing bodies, a real strong bond, if you like, promoting collaboration, because none of us have got the answer. The answer is only going to be found by pure joint working, bringing all of the parties together to look at developing a plan that would initially start to see elite athletes coming back to be able to train, then through to where we are now, where we are paused, sadly, at the behind closed doors. So we're seeing live sporting, competitive sporting events taking place, but sadly, at this point in time, without the benefit of spectators. And then through to eventually to see the final stage, which would be the full return to life pre-COVID. Now, to support that final stage, or the government stage 5, I was asked to write a document which you referred to there, Dan, called Planning for Social Distancing at Sports Grounds, to support that stage 5, so that when government determined that the conditions were right for that return of sports grounds, then the sports grounds themselves would have, if you like, some template that they could work to, that would show some kind of benchmarking as to how they could work out and determine what a safe, socially distanced capacity would look like. So I guess the key part, I guess, for my appearance on this panel is to tell you, well, what have I learned in the last 6 to 8 months? And I think for me, there have been many new things that we've learned, but I think that some of the things that we found are not necessarily new approaches, but they're more improvement on old approaches that perhaps we haven't been doing too well. I think confidence building, and that confidence will come in different shapes and forms to different groups involved, but certainly in terms of spectators. Around the world now, we're seeing that many spectators are being away from live sporting activity for 6 or 7 months. There's an old saying that it takes 6 weeks to form a habit. So it's going to take some encouragement for many of those people to return to the sporting fold, because the world that we live in now has the avoidance of mass gatherings. Kind of that's the new norm, isn't it? So to get people to break that mold, to get the confidence to return back to sporting activity is going to be a big ask of many, many sporting events. I think the other bit that will play in there will be that I think that will show a difference in return of the sporting demographic. We're all aware that this COVID, people with underlying health conditions aren't necessarily more prone to contract the virus, but if they do, then the outcome could be more serious than someone that doesn't have those underlying health conditions. So I think in the short to medium term, until that confidence comes back, we might well see a different form of demographic in terms of the people coming back. I think the confidence of fans will play very much into what they see as the confidence coming from the venue organizer itself. Do they look like they know what they're doing? Do they look like they are confident in being able to run an event initially under socially distanced conditions, but then leading to the greater number of spectators coming back? Because all of that will give the confidence that will be needed by governments around the world to give them the confidence that they've got an audience, but more importantly, that they've got venues that are capable of discharging those higher levels of vigilance and protection in terms of public health and safety to the people who do decide to come back. I think the other important point that I've learned over the last 6 months is that the solution for me has got to be localized. I think the one size fits all in terms of risk isn't going to work. I think that you need to look at and factor in local prevalence. Then you need to look at the ability of the venue, as I was saying, to carry off an event. And that plays largely into the competence of the safety management team that would be in charge of looking after the numbers of fans coming back. A big concern has also been around transport, how people get to and get from events. Certainly the use of public transport is more risky than people coming along by private motor vehicle. So it's a case of venues looking and examining their travel plans and seeing what they can do to come up with kind of almost a risk score with the event, but then overlay it with mitigations that can put in place, which might say that an event in one part of the country is reasonably safe or would be acceptable to take place, where maybe an event in another area of the country, because of maybe local conditions, may not necessarily be as safe. So I think and I think that problem just on the travel really is kind of emphasized, that the bigger the event, then the bigger that problem comes, because as COVID plays out at different stages around different parts of the world, then the transfer of those people from different parts of the world to the host city or the host country becomes much more difficult to manage. But I think I've kind of left the area where I'm going to hold my hands up and say that perhaps myself and others within the industry haven't done particularly good in the past, and that's with engagement with spectators. Because the one thing that I've learned in writing the guide to social distancing at sports grounds is that there isn't a management team in the world that can carry this off if they don't engage with spectators and get spectators to be fully part of the issue. So it's looking at the successful outcome where spectator engagement is essential. Where we've gone wrong in the past, I would suggest, is that we've looked to control crowds rather than to manage and to work with them. So there are lots of things that we're doing now around the human behavioral things. I did suggest a customer or a spectator code of conduct in the guidance document, which I think has been widely accepted. I've got to say the document has been picked up around the world. It's now translated into German, into French, and into Spanish, which are the FIFA languages. So that is helping with the kind of the preliminary matches that are being held now for the tournament. But it's got to be supporters at the front of this. We've got to do it with their full engagement, with their full support, because never have we needed that collaboration and that working relationship with spectators more than we do at the minute. So for me, I guess my key management is that we need to manage spectators, but we need to do it with their consent.
Okay, really interesting, Ken. Thank you for that. And don't forget, for all of you who are listening and watching this, we're talking about health challenges in hosting major sporting events. Ken was talking about what the world would look like post-COVID, and we've got some questions coming in on that. But before we get to your questions, do keep sending those in. Talking about big events there with Ken, one of the biggest events of them all is, of course, the World Cup. And there's one, hopefully, fingers crossed, coming up in Qatar in 2022. So let's speak to Dr. Abdul Wahab Al-Musli. Thank you so much for listening, I know, carefully to everything you've heard from Tina and from Professor Lucille and from Ken and Abby so far. I wonder, with your sort of World Cup hat on and managing and measuring all the things you've heard so far and understanding what's happening with COVID-19 as well, how are you sort of trying to bring all those multi-agencies together and address the huge health-related challenges of putting on a World Cup and all the infrastructure and all the public messaging and all the legacy planning that goes along with that?
Yes, good evening, Dan. Thank you very much. First of all, thank you for hosting me in this important webinar, very famous conference, Wish 2020. The second point is there were several interesting points and concepts raised by your esteemed guests. and they are especially going to be of interest to us in adopting some of these lessons and concept in the preparations for the World Cup. As you Dan know, that Qatar is not just preparing for the World Cup. Qatar is considered one of the world famous and attractive countries for events in general, which is one of them, and sports events specifically. We have done previous major events like the Asian Games in 2006. We've done the World Athletics recently before the COVID comes into picture. And we are bidding for several major mega sporting activities. We're bidding for the Asian Football Cup in 2027. We're bidding for the Asian Games in 2030. And I'm sure we will bid for the Olympic Games sometimes in the future. So that's being said, of course, have in the past required that Qatar to develop its capabilities and the infrastructure for such mega sports events. And part of these capabilities is the interactions and engagement of the multiple authorities and stakeholders and the events, and especially in sporting activities. There are in Qatar multiple agencies that are responsible for these various sporting activities, like Qatar Olympic Committee, the Ministry of Sports and Culture, the Supreme Committee for Legacy and Delivery, Qatar Football Associations, and many other sporting federations. When it comes for the World Cup, of course, the preparations for the World Cup is mainly under the Supreme Committee of Delivery and Legacy, as you know, with the support from various ministries and more than 25 functional areas from the various parts of the country and ministries. These multiple stakeholders are quite used to coordinated engagement in this regard, in preparations and in execution of a sporting event. They have been testing together for specifically for the World Cup in several events so far for more than 2 years now. And in 3 days, we are going to mark exactly 2 years to the kickoff of the World Cup 2022. And we have another 2 years to do further test events, and many of them are coming in the pipeline. As you probably heard last night, the FIFA have announced that the FIFA Club World Cup, which has supposed to be hosted before in Qatar in 2019, in 2020, has been postponed because of COVID. Now it's coming back in Qatar again in first quarter of February, in fact, in 2021. And the engagement of these various stakeholders have given the country the capabilities of hosting the events professionally. When it comes to the health infrastructure, as you know, the country, of course, is investing hugely in the infrastructure as part of its preparations for the major events to come, and especially the FIFA World Cup. And that does not exclude healthcare. Healthcare in the next 10 years, in fact, many of them before 2022, is going to be building many healthcare facilities, expanding, doubling, in fact, its bed capacity, doubling its capacity in terms of the ratio of physicians to populations, and so on. So there is a huge investment in this regard. The medical affairs in the Supreme Committee is responsible for the planning, coordination, and execution of the healthcare services for the World Cup. now in conjunction, especially and in direct engagement of important stakeholders, especially FIFA Medical Committee, the Ministry of Public Health, which plays a really major, maybe the most important role in supporting the Supreme Committee for delivering state-of-art healthcare services. Hamad Medical Corporation being the main service provider in the country, and the Public Health Corporation. In addition, specialized hospitals like Aspitar, which provide the world-class sports medicine service for the athletes and players who are injured or require sports medicine services in the country. So I was interested to hear Abby talking about the international franchise owners putting a high bar for their services requirement from the host country, which is absolutely true. But we are fortunate in healthcare services that our own healthcare services in the country is in fact has a higher bar than the requirement from FIFA. So that makes it easier from our perspective to provide the lower bar expected from us to provide by the FIFA World Cup. And I'm proud to say this. And in the last 20 years, the healthcare services and of course, governed by the Ministry of Public Health has improved so much in terms of infrastructure and governance and policies and procedures and healthcare provision and hospitals. For that purpose, one of the speakers talked about the importance of developing the governing structures. We in healthcare do have a clear governing structure coordinating the two entities. The Supreme Committee has a governing structure, and the Ministry of Public Health has a dedicated governing structure that started 2 years and continuing until the World Cup, specifically for the for preparations for the World Cup. As you know, the country is small. We expect almost about 1.9 million to visit a country as a spectator throughout the 4 or 6 weeks of the tournament. And therefore, the country, the Ministry of Public Health, needs to maintain the healthcare services for the entire population. And we cannot allow an event to compromise the healthcare of the public. So this is really an integral part of the planning and preparations of the Ministry of Health in the country. The COVID-19 has, of course, posed additional challenges to the whole map for the preparations and for the planning and execution of the services, and added very important public health measures that, of course, need to be considered for any future events, including the World Cup. As you know, COVID-19 has come and it's not leaving very soon. So it will remain to be hanging there, even with the vaccines and wide distribution of vaccination of people, but there remains, and therefore the public health measures becomes important. This, of course, which I can say fortunately in a way, has made the health aspects of the sport events more important. And now the authorities, the local organizing committees and the international franchise owners do pay a huge attention to the to aspects related to the public health measures. And as part of the countries, as you know, the country has went through the 4 phases of COVID-19. We went through the escalation, then the plateau, and then the descent of the the cases, and we're fortunate that we didn't have. Hopefully, we will not have a second and third wave. And the Ministry of Public Health, in coordination with all the support from the various stakeholders, were able to keep the threshold, what you call it, the curve below the threshold, and therefore Qatar is one of the least countries in the world with respect to mortalities from COVID-19. But a part of the lift up of the restrictions that were put during the peak was the resumption of the professional sports and activity in the country from September. And since then, we had local, national events started without spectators under closed door, then with limited spectators up to 30% in outdoor settings and 20% in indoor settings. Then subsequently, we have engaged in many international events since the lift up of the restrictions on professional sports. Among them, we did the Diamond League very successfully with more than 250 international athletes participated in Qatar very successfully and thankfully without any eruption of hotspots or COVID-19 spread. We also did important events like the Asian Football Confederation, the East version, very successfully, and that was the first time we adopted a unique experience with the bubble-to-bubble, and I think it's unique in the world because I think it's the first time where many clubs, in fact 15 clubs, were part of the entire bubble from their bubble hotel to the bubble stadiums with many public health measures put in place. So all of these experiences have given the country the unique opportunity to be able to do and plan for any sporting events under any circumstances. And with the great lessons learned during these events that built up our capacity.
Great. Thank you very much for all your answers to those. We don't have that much time left, so I'm going to ask you all to be brief as you can as we try and get around some questions, if that's all right. If you could keep your answers about 30 seconds I know there's a lot to get in, but if you could do sort of 30 seconds to a minute each, that'd be great. And touching on quite a few of the points that you've made, Steve has asked this question, and maybe Abby, we should come to you on this first. Steve says, this is for everybody. It's estimated that we'll be facing a healthcare crisis every 5 years or so. So given what you've been talking about with COVID-19 and future planning, will sports ever return to a pre-COVID state, do we think? Or, and I know everyone hates this phrase, but are we facing the new normal indefinitely? Will all sporting events have to be planned with a sort of pandemic in mind, Abby?
Well, I think the reality is no, there will be a new normal, but we will not revert to anything that we've had in the past. And I think the perverse effect in a positive sense of COVID is that it's given us a whole new area of preparedness experience. And we'll need to be better at anticipating the possibilities and having plans in place to accommodate whatever situation faces us. So return to the past, not going to happen.
Okay, Ken, what about your thoughts on that? Do you think that is going to be something that's going to be part of event planning?
Yeah, I think so. I think the pre-COVID, my big concern with the future design of sports venues and therefore how events themselves will be planned was around the millennial generation and how we engage with them. I think what we're going to see because of COVID is that we will see smaller venues, but we will see them better connected. We will see them where we can learn from the experience of COVID to build in, if you like, more generous space allocation for people. So that if these things do come along with increasing frequency as the future goes forward, then, you know, that we are better placed to deal with it.
And Professor, what about your thoughts on events from now on?
So COVID will go. We will get a vaccine. I'm optimistic at some stage. I think communicable diseases will have to be considered in all future events. It's not just about sporting injuries, etc.
Okay, thank you. That's the shortest answer so far, Professor. Well done. A gold star for you. Tina, I think linked to that, but also a question that's coming specifically for you. I'll read it for you. Picking up on your point about public health messaging, can we use the platform and celebrity profile of major sporting events to help promote better public health behaviours? The example they use is mask wearing, hand washing. As we move again, the phrase is the new normal of mass gatherings. What can we learn, do you think?
Yeah, I think I'll just reiterate everything that everybody said, that it will be a different world, but we will have to do things better because we'll have to learn from this. We always say expect the unexpected. There's been a whole series of, H1N1, Ebola, Zika, COVID-19. So there's these things happen regularly, so we have to learn from them. But absolutely using sports celebrities to actually advocate. And we did some of this in London 2012. We had some of the athletes go and work in the schools with children to kind of like get them engaged in sports, but also about public health messaging. So it's a really good, very, very effective role of advocacy and support because they'll listen to them. They won't listen to people like us. They'll kind of like talk and listen to the famous people, quite rightly.
And Doctor, this is a specific question for you. Talking about some of the instances of sort of weather-related issues. In the context of weather-related phenomena, says this question, in relation to heat, what measures are Qatar seeking to implement to mitigate against any adverse health outcomes? I think the question is about during the World Cup, but I'm sure you can talk about that around some of the other events you're hosting as well.
Yes. Yeah, well, the World Cup is, of course, happening during the best time in the country with the best weather. It's starting in November and ending in December, and the temperature is around between 20 and 25 in that part. But despite that, as you know, the country has built the infrastructure for events to be hosted all around the world. You know, all our 8 World Cup stadiums are air conditioned, and if you attend the matches of the AFC yesterday, you'll see that the temperature outside is around, maybe now it's around 27 to 30, but inside the stadium is around 21, and it remains at that degree. So there are many things that the country is doing to be able to host these countries. Among them is the improvement in the infrastructure, but also how to deal with the potential heat-related insults and injuries. You know, in terms of promoting hydration and using the shades and avoiding the sun. Qatar, for example, restrict the working hours during the very hot summers for the labor work, you know, so there is a shift of work from the daytime to nighttime when it's cooler than the daytime. So there are many things that are in place and can be done to mitigate the effects of the heat. And in sports events, other than the outdoor, if the like the other sporting events, majority are indoor, and the indoor are all under air-conditioned environment.
Okay, thank you for that. I think, Ken, this is a question which has come in, which I'll start with you on this, but it will touch on everybody, because you said one of the major issues was about making sure that we communicate well with spectators, those who've paid their good money to sort of come to these major events. I wonder whether, going around everybody, from your area of expertise, what would be the one piece of advice? What's the best thing you've learned about how to communicate best with spectators, whether that's about the public health side of things or general information about hosting these major events? Ken, do you want to give us a sort of tip or something you might advise those who might be thinking about an event in the coming years?
Yeah, I think the first thing is probably it's easier to say communicate than actually do it. It's finding out who represents spectators, and that is a problem that we've always had. But I think that shouldn't, the fact that it's a difficult request shouldn't deter the fact that we need to do it. So for me, it depends the level at which you're working at. Clearly, if you're working with major governing bodies around the world for big events, then you've got to have an understanding of who your expected clientele will be. And it's getting messages out in as many different forms as you can to these individual groups. If they've got representative groups that associations that promote their requests, then by all means engage with them. But for me, that lies at the heart of the solution to not just the problem of COVID, it's just generally attendance at sporting events. I think we've missed a trick for so long now that we've never really involved the key people in this. This is the entertainment industry. These people are coming along to enjoy themselves. And I think that we have missed a trick over a number of years now in not involving them in the process and finding out, what it is that they want. The sports demographic is made up of lots of different groups of people. It isn't one particular form of demographic. You've got family groups, you've got those that want to come along and sing and shout and enjoy themselves. There's a whole range of people that we need to drill down and find out what their wish and what their requests are, because I think once we start to engage with them, then we will get a lot more compliance. And in the world, as we move on living with COVID and post-COVID, we are going to need that compliance. We're going to need their involvement.
Okay, Professor, it looks like you're making notes there, Professor. I don't know whether you've got something to add to that as well.
Yes, so my major work is around bad news and outbreaks. So if there is an incident around a major event, you need to get information out very quickly. Even if you don't have all the facts, you need to say what you know, you need to keep communicating. Otherwise, social media will beat you to it with lots of misinformation and rumors. Be quick and be proactive.
Okay, quick and proactive. That's very helpful advice. Tina, what about you? I noticed you enjoyed what the professor said there. Would you echo that, do you think?
Absolutely echo that, and trusted advice. Get somebody who the public recognise, trust. It goes back to using some of the athletes, the sports people as champions, because people will trust them. They're a respected voice. So look at doing things a bit differently. Use technology, but kind of like make sure people believe what you're saying, and that builds on what Lucille was saying.
And Doctor, are you constantly learning from the events that you're hosting in Qatar about that sort of information and giving it out to the public and those who are hopefully attending?
Yes, absolutely. It's not just in terms of a sports event, but COVID-19 has proven, and I agree with the professor, absolutely. If you are not proactive and quick and direct and straight and transparent, then rumors will be distributed. But we have found out that although, of course, messaging and communications are extremely important, but in relation to the sports events, I think also the presence of compliance teams and within the stadiums and wherever there are spectators are extremely important, because people tend to try to go to pre-COVID era, and they ignore the public health measures, and so they need to be reminded by a big number of people who emphasize to comply with these measures.
Okay, very helpful. And Abby, listening carefully to everyone else's advice, I wonder what you would add.
Well, look, only to say that I think the teachable moment is now. Somebody mentioned earlier individuals who are now kind of desperate to go back, I think, to see live sport events, but they're developing their own kind of risk mitigation and risk assessment plans. So this is an opportunity to kind of play into that with some good advice. And historically, we've tended to think about spectators. We sell them a ticket and then we cater to their needs in the stadium. Maybe we worry a little bit about their transportation. But I remember Tina knows this, really struck in London 2012. You'd go into the Olympic Park and, you'd be 20 seconds off the train, and the engagement with the spectators help pass the time of these incredibly long lines was just phenomenal, and it was all great fun. But there's an opportunity now to make that kind of engagement more practical and more meaningful. And the last thing I'll just say is that I think we have so underutilized technology that could be rolled out in stadia to engage with people in a fun but informative and meaningful way. So there's a whole world of engagement with spectators through multiple modes that is now underexploited, and I think there's an appetite to improve that dramatically.
Okay, I've got time for one more question, which, Abby, I'll start with you because it's been directly addressed to you. But if anybody else wants to jump in as we sort of bring things to a close on this Wish Forum panel for 2020. From a World Athletics perspective, Abby, Steve says, what is your view on the prospects of the postponed 2020 Tokyo Games actually having spectators in it in 2021? What are your thoughts on that?
Well, I wish I had a crystal ball. I don't. I think it's going to be very vaccine dependent, and I think this is one of these issues that I was alluding to before. Well, there is the issue of the entry to Japan of international spectators. There is equally the issue of the protection of the Japanese population, who to this point have done a pretty good job of managing COVID. So I would say, frankly, it's too early to tell. There will be spectators, I believe, but whether they are scattered throughout large stadia in small numbers or more numerous, I'd like to say I have a view, but I think it's too early to say.
Yeah, and Tina, on that note, it is just hard to know, isn't it, with any certainty exactly what major sporting events are going to look like, all those that have been postponed from this year.
Yeah, no, absolutely. And, I think having a crystal ball would be invaluable at the moment, but we just do not know. There are so many unknowns. There's some fantastic work with the vaccine development and that, but there's still a lot of questions there. I think we have to plan for scenarios and the mitigation required against those and hope for the best.
And Professor, is there anything you'd like to add as we sort of draw this to a close on that point of what might happen next year and fans in stadiums, and I suppose the considerations we should have in our minds?
I think for 2021, I think we need to be pragmatic but careful. I think things will improve in 2022, hopefully. We need the games to begin.
Okay, well, that's a nice
Then
way to
I
finish.
can,
Yes, of course, Doctor.
I can add a point here. I think even without, I'm sure, I'm also optimistic that a vaccine will come and hopefully will be distributed to all the world. But even without the vaccine, I think the improvement in technology, and especially in relation to healthcare, I think next year is going to make testing much faster, much easier, that can detect the virus on the spot very quickly, even if you do not have a vaccine. On the spot for spectators coming into the stadiums can be, and I think that will happen. We are in fact entertaining doing that for one of our sporting events here in Qatar next month. But I'm sure in 2021 the technology will be much faster in identifying the virus that can happen in seconds, and therefore you detect the negative people and then allow them in as spectators.
Okay, thank you. I hope the rest of us will be sharing your optimism as well. Thank you so much to our panelists. Can I thank Abby Hoffman, Dr. Abdul Wahab Al-Masler? Thank you so much for that. Professor Lucille Blumberg, Tina Enrichs, and Ken Scott as well. Thank you to all of you for watching this Wish 2020 Forum panel. We've been looking at organising these huge sporting events and some of the healthcare issues around that. So many questions. I hope you've enjoyed listening and found some of that advice helpful from our experts today. Organising these events is obviously incredibly complex, and there are so many things to consider. But the wealth of experience we've had here today, I really do hope you've been able to take something away. Investment is essential, particularly the early planning in those legacy programs. I think that's one thing that really has shone through today. And also the importance, as we mentioned right back at the start, of sharing information, starting to plan early, and trying to make sure that there's that acknowledgement, as Abby said right at the start, of the tensions that can be between local authorities and governing bodies. And hopefully 2021 will look a lot better in terms of those major sporting events than 2020 has. Thank you for watching. Thank you to all of our panelists. We'll see you again soon. I hope you've enjoyed this Wish Panel Forum for 2020, and we'll see you another time.